a few words about some of the public sector duty work that we're doing at the moment. The first piece of work we did in March of last year was something called Capturing the Gains, where we looked across sectors, including health, criminal justice, local authorities, and so on. What we wanted to do was find good practice that was connected to the public sector duties. And this is something that I think I would like to come back to, which is the idea of you are not alone. There are other people out here who may well have solved the problem that you have in front of you. And if you can get hold of that person, that solution, that momentum, you may be able to use that yourself. There's a lot of strength in that, and that was what we were trying to do here. We came up with one particular health example, which was Forth Valley NHS and the monitoring of their workforce and the good work that they'd done in increasing the return they were getting from their staff. I recognise that that's workforce monitoring remains an issue for the health service, but there is perhaps good work that can be picked up on and expanded that's already taken place. Some of our public sector duty priorities at the moment, two projects, one which we're calling Better Policy, Better Lives, where we're looking at equality impact assessment, which we recognise that people are struggling with across different sectors. And we would expect that where people are doing well, those are for the same reasons, and where people are doing less well, those are for the same reasons as well. We've chosen to look at 3 areas of Scottish Government policy development in some detail, including an element of health policy with the Patient Experience Programme. We're also looking at elements of drugs and housing policy, and we expect to be able to push the lessons that we find from this project out to other sectors. So this is not simply about government policy work, but these lessons will apply equally to anyone working in another sector trying to do similar things. So that's what we aim to do with this project, and it will be reporting June, I would expect, of this year. The actual timing of that will need to take account of other things that are happening at the same time. Our second public sector duty project that I'd like to bring to your attention is something that we're calling Counting the Cost, which is looking at local authority decisions within the first year of the Concordat and the Single Outcome Agreement, which is a major change in how central and local government relate to each other across Scotland. And we're looking at the existing duties, race, disability and gender across all local authorities in Scotland to look at the decisions that were made in the context of the introduction of this new regime, new way of looking at delivering outcomes. Yvonne has already touched on the wider macroeconomic context, and we've made clear our expectations in a piece of guidance that we issued last year, guidance on financial decisions, where we are making clear that we expect equality impact assessment to be more, not less important in the thinking of public bodies in financially straitened circumstances where people are examining service cut options and so on and so on. And we run a public sector duties panel which brings together our own legal and policy staff to consider new information which has been brought to our attention on a monthly basis. And I would say that especially within local authorities at the moment, we're beginning to see a very strong pattern of decisions relating to services and especially about impact assessment and people complaining about impact assessment practice in that context. I haven't seen anything within the health service so far. I don't know whether that's to do with your budget cycles or, but that's certainly a strong pattern that we're seeing within local government at the moment. This slide just brings together some pieces of information that are relevant to the subject that we're all here to discuss today. If you're in the transgender workshop, you'll know about the guidance that we've just published this week, I think, which is about guidance to help public bodies meet their equality duties and human rights obligation in the provision of goods, facilities and service for transgender users. It draws on a number of it has a chapter on health and social care and draws on a number of good practice examples, including Greater Glasgow and Clyde's work that Alistair Lowe was talking about in the transgender workshops, if again you were in there. We have also published equality impact assessment guidance recently, new guidance. If that's something that you're working on, you might want to be aware of that. We have been in correspondence with the Cabinet Secretary for Health and Wellbeing, expressing our concern about lack of progress in the ethnic monitoring of patients who access the NHS in Scotland. So that, again, is a bit of a live issue for us at the moment. And the last thing I'd like to draw your attention to on this slide is the Dimensions of Diversity report, which is Scottish Public Health Observatory report, which found that across most groups there's a repeated finding of diminished mental health because of the pervasive and insidious effects upon well-being of experiencing personal prejudice, collective discrimination and structural exclusion from full and fair participation in Scotland's material prosperity, social life and power structures. I think that's a very important link to make, the link between the experience of discrimination, mental and physical health. So, to finish, just to focus down on the gender duty, you'll be aware that the Equality Scheme review and revision is due in June of 2010, and this gives us an opportunity to pick up, to maintain momentum on gender equality work. You may find useful our guidance, a practical guide to revising gender equality schemes, again, if that's a task that you have in front of you. All the material that I've mentioned that we have produced is available on our website. Also, you'll be aware that by September 2010, boards are required to review and report on equal pay policy. Our own monitoring and enforcement approach to this is that we're actively monitoring such sources of information as tribunal cases and so on and so on. We will not be systematically monitoring across the sector. What we will do is, where something has been brought to our attention that we think may be a serious problem or a strategic issue for us, then we will look at the what has been done to meet the duties in that public body. So that's for health boards, that would be a risk-based approach they would need to take to the fact that they knew that is the enforcement approach that we're taking. And I would just like to add as well that equal pay is a strategic issue for the Commission in general. I'm sorry that's been a bit breathless, but I needed to cover quite a lot of stuff, and I will just finish by putting up our contact details there if you need to use them. Thank you.
Thank you.